and simply, I'm the owner and director of Your Podiatrist Brisbane. Welcome to the 7 secrets to foot pain relief within 17 days or less. How is that possible, you may be asking? Look, I've been a podiatrist for 19 years, and what I've found is that there are particular things that if you do and you do them consistently, is that what we can do is we can help you relieve your foot pain. Now, these are some of the things that you can actually do at home before you actually go and see a podiatrist and get things done for a podiatrist. Now, foot pain sufferers, like yourself, because you're watching this, is what you'll find is that you're in extreme agony. What you're finding is that you're very drained, you're feeling very lethargic, you're not very sociable, and you're being in pain. You don't really want to be around people. You don't want to be doing activities, and life just really sucks for people who actually have foot pain. I've actually suffered foot pain myself, so I know exactly how you're feeling and how things are going and where you're actually at. That's one of the reasons I got involved in podiatry, was that as a young fellow I played a lot of sport. And when I played a lot of sport, I had a condition called growing pains and Sever's disease in children. And what happened is that this went untreated for about 5 to 6 years, because my mother took me to lots of different practitioners and they didn't know actually how to treat it and treat it effectively. And it took one doctor, after about 6 or 7 years of seeing different people, is one doctor sending me to a podiatrist. And they actually implemented a treatment strategy for me. They got me into better footwear, wearing customised foot orthotics, and within 3 months all of my pain that I'd suffered for all of those years had actually settled themselves down. And so that was one of the great things. I was quite impressed with how that actually responded to me, and I thought, well, and when I finished year 12 I thought, okay, this is something that I can do, that I can give back and actually help people. So one of the things, but you're here, you want actually relief. You're actually looking for some of the strategies that you can use today that are actually going to give you foot pain relief to get things to settle down, so to get you back on track. So first thing about foot pain is, what I've found is that often with foot pain there are 2 reasons why you're actually getting foot pain. First reason may be because of an injury. So you've sustained an injury to the foot. Now, an injury may have been an injury a few weeks ago, a couple of months back. It could even have been 20 years ago that you sustained an injury to the foot, and now, because you've changed the way that you're walking and your gait, is what's happening is you're getting pain in a particular area of the foot. Sometimes an injury can be something as very simple as changing footwear. So particularly if you're an athlete or a runner and you may have been wearing a particular brand of shoe, using as an example, you may have been wearing Brooks for the last 15 years, but you decided to change over into an Adidas shoe. Now what happens is, with different footwear, what happens is they're different makes and different designs, and by changing into footwear it's brought on an injury to the foot. So there's injury. The second thing that can happen, and the most common thing, is that we actually see is what we call posture-related problems. And with posture-related problems, what happens is when the foot is not sitting in the right position, such as if the arch is flattening, or the foot's collapsing down, or the arch is collapsing down, or if you have a very high arch, or the foot's rolling out too much. Or sometimes people can get a combination of both. They've got a really high arch, but when they start to walk and do activities, the arch starts to flatten out and puts a lot of stress and strain on muscles, joints and ligaments around the foot. But what also happens is, when we have foot structure or foot posture problems, is because the foot's not sitting in the right position, it puts a lot of stress and strain on other structures in the body. Most commonly it can affect ankles, legs, knees, thighs, hips, and also lower back areas. And they tend to be the most common areas that we tend to treat in relation to foot posture problems. So the first step in relieving foot pain is actually getting correction of any foot postural issues, or addressing any problems with footwear issues, old injuries. And the most common way podiatrists actually address what we call foot posture issues is with the use of prescription foot supports, customised orthotics, customised foot orthotics, arches that slip into the shoes and actually change the foot in a very specific way. Now, a very good podiatrist, what they will have is they'll have an arsenal of material that will actually help to design a really good custom orthotic or custom foot support for you. So they'll have very good clinical skills. They'll probably use diagnostic equipment such as x-rays, ultrasounds, MRIs to see what's happening with the structure of your foot. They'll also have video gait analysis to take video and of your gait and how you walk and how you run. They may also have dynamic pressure reading on the bottom of the feet as well that actually help to do that, or optical scanners that help to give a 3D image of the foot. With all of this information combined, then they actually can sit down and design a customised orthotic for your specifically foot posture problems and what's going on for the rest of your body. Now, a really great podiatrist who is really good at manufacturing orthotics and designing orthotics, they'll actually design the orthotic that will have an effect on the feet, but if it's designed correctly, it'll also get the hips and pelvis sitting in alignment and helping to get the knees into better alignment as well. And so generally what happens is they can only do that if they've got really good equipment or technical equipment that can help them to do that. So that's the first thing. Something that you can do at home is that you may want to try buying what we call off-the-shelf orthotics. Now, with off-the-shelf orthotics, they're not custom-made. That's the thing you need to understand. They're not custom-made, they're not designed specifically for you. But what I find personally is anywhere from about 20 to 30% of people will get some results using a off-the-shelf orthotic. Look at purchasing one of those and giving those a try. You can try a myriad of different types. There's hard ones and soft ones, and depending on what's actually happening. So if you've got heel pain, sore heels, you might go for something a little bit softer. If you're getting an arch that's collapsing down or pain in the ball of the foot, you might go for something a little bit more supportive up through the arch area. So that's the first step. Second step is footwear. Now with footwear, what I would highly recommend for you is that look at wearing a footwear that gives you most relief of pain. Really, really simple, very easy idea. So for some of you, it might be wearing a runner or a jogger or an athletic shoe that actually gives you most relief. And what I'd encourage is that you wear those shoes 24/7. So wearing them 24/7 is what's helping support the foot or give you most relief. For some people, a little bit of a wedge heel, particularly for women, if you've got sore Achilles tendon, if you're getting a bit of heel pain, that may also assist in alleviating some of the symptoms in around there. So wearing something with a little bit of a wedge heel, but that's wide, that keeps the foot nice and stable. So get into the footwear that's going to give you the most relief. If it's a pair of thongs or supportive thongs, so be it. Look at wearing those that actually give you most relief, just at this particular point in time. As symptoms start to decrease, what I'd encourage you to do is look at getting into, say, a runner or a really good supportive shoe around the heel and the ankle, and that also helps support the arch of the foot. And so after the symptoms start to settle, look at getting into that better footwear for you. But the second step is looking at getting into some shoes that's going to provide some really, really good support and help alleviate symptoms. Okay, so the third aspect is looking at decreasing pain. We want to settle the pain and decrease the pain as soon as possible, ASAP. Some of the key things that you can use in terms of decreasing pains, for some people, probably about 20 to 30% of people, using an ice pack, wrapping an ice pack up in a towel, putting it on for 10 minutes, taking it off for 20 minutes and putting it back on for 10. That will help to decrease some of the symptoms that are actually presenting and look at decreasing pain. Some other things that you can use are over-the-counter preparations from your pharmacy or chemist shop that help to anti-inflammatory properties. Now you need to be really, really careful and need to check with your GP or doctor that you won't get any adverse reactions to these particular products. Particularly those people who are taking medication, you need to check that with your doctor before you actually do that. And so these over-the-counter preparations, you can rub onto the area where you're getting pain. And what they normally do is they normally decrease the swelling and decrease a little bit of the inflammation. And when they actually settle and decrease the inflammation, that's when you actually get the pain relief. Look at using those in combination with using the ice pack. One of the key things to really remember, if anything aggravates things or makes things worse, then stop it. Stop it immediately. We're about getting the symptoms to settle down and not actually making things worse. Some of the other pain relief, sometimes it's rest, particularly with foot injuries and particularly acute injuries. So let's say you've twisted your ankle. Sometimes it's just about having rest to allow the actual part to settle itself down and heal. And one of the key things is actually lying down and slightly elevating the foot, so it's about, say about 3 to 4 centimetres above the level of a heart, so the fluid can actually start to drain back into the heart. Sometimes just doing very gentle movements of the feet, so pumping the calf muscle up and down, And what that will do is that'll get the fluid moving out of the area as well. With any of these activities, if it aggravates or makes things worse, then stop them. Really, really simple, really, really key. And so look at elevating. If you can do that anywhere from 2 to 3 times a day, that would be fantastic and great. The other thing about doing decreasing pain is decrease those activities that aggravate that aggravate the foot or aggravate your foot pain. So let's say you're a runner or an athlete and you get to about 5 to 6 Ks and the pain starts to kick in. Well, what you may find is rather than running is that you may have to do some cycle activity or some swimming to keep up your levels of fitness and until the actual injury starts to heal and settle down and repair itself. Some of the other things that you can actually do to decrease pain, if it's really, really acute pain, you don't want to be massaging the area, but let's say you've had the pain for a couple of months and it's not settling itself down, sometimes gentle massage in the area can actually start to settle it down. You need to be really careful. A couple of things is, one, if the massage aggravates or makes things worse, stop it. If it really causes intense pain and really, really flares things up, well then you should seek medical advice. This information that I'm giving you is just something to supplement you before you actually go and get professional advice. And I'd highly recommend that you need to go and get professional advice regarding what's going on with your feet. So the first thing is decreasing pain. Once the pain's starting to settle, then what we can actually look at doing is doing some rehab to get some strength back into the muscles, get the feet moving better, and increase your forward movement and look at improving your gait as well. Okay, so the fourth area that we need to look at, number 4, is actually decreasing swelling. So with most foot pain, what we'll actually see is that there will be some swelling that's occurring in around the area. Sometimes the swelling can be really, really subtle and can only be felt by touching and palpating, but most foot pain problems, you can actually see a difference between both feet and see where the swelling is. So ice and compression, rest and elevation are the key aspects to actually decreasing swelling. So using ice, so with any ice packs, no direct contact onto the skin, but wrap the ice pack up, might be in a little towel. The other thing you can do if you have foot pain is put a sock over your foot and then look at putting the ice pack on for 10 minutes. Keep it on for 10, take it off for 20 and put on again for 10. If you've got a compression bandage wrapped around with the ice pack, what you'll find is that will help to move the fluid back up towards the heart. So ice and compression, that elevation again, so elevate about 3 to 5 centimeters above the level of the heart so it can come back, and just look at resting that particular area. So in terms of number 4, it's a decreasing the swelling. Okay, step 5. Often something that's not really touched on but is important is nutrition and supplements. Often what we find is that not a lot of people, but some people are actually nutritionally deficient, and particularly the elderly. Often they're not getting proper nutrition, really good nutrition. So sometimes what happens to move the healing process, to get the healing process moving along nicely, is that we like to supplement and provide some supplements that are actually going to help in those areas. Some of the common and easy ones that we actually like to use is magnesium, zinc, and vitamin C. They're probably the 3 key ones that I look at utilising for people to help supplement their body to get it moving as well. Some of the other things is water intake, and sometimes I'll use a naturopath, a dietitian or a nutritionist to help have a look at people's diets as well. So sometimes they're not getting enough nutrition to help support themselves for the healing process as well. So getting other practitioners involved to help you with your healing and help to overcome your foot pain is often a really critical area to look at. So the 6th key area is looking at massage. Often with a lot of injuries to feet and to muscles, we get these areas called trigger points. And with the trigger points, there are very discrete areas within the muscle bellies that are very tender and very painful, particularly when we actually touch. And what they do is they actually pull the muscle into like a very small spasm that doesn't allow the muscle to function as well. And what it does, it pulls the foot into a different position, and when the foot's pulled into a different position, what it does, it puts excessive stress and strain on the structures of the feet and can often lead to foot problems and foot pain. So what we want to do is we want to actually look at engaging massage, particularly massage sometimes using trigger points, to actually palpate and massage those trigger points out so the healing process can move along. Particularly with your foot pain, this is something that you can do at home, is just get in there and actually touch and move and rub the muscles and see where they're actually sore and painful. And what you might want to do is just some gentle massage, and gentle massage in a very circular area, putting a light pressure on the muscle. And by doing that, what that does, it helps to move the trigger point and get the trigger point to actually start to loosen, get the muscle to actually start to relax a little bit, so it can help with the healing process. Sometimes getting a massage therapist to help with that, sometimes even something is a little bit offbeat as using a reflexologist. They're really good at massaging the bottom of the feet and helping with the tissues. So sometimes that can actually help in helping with your feet. But the key thing is, before seeking those practitioners, is getting a really clear diagnosis as to what's going on and what's happening with your feet. Okay, and then number 7 is prevention. And prevention is looking at implementing activities, having a look at your footwear, having a look at your posture, doing regular checks to make sure your posture is sitting in the right position, and to ensure that if you've got customized foot supports, that they're working well for you. Also, what prevention is having a look and assessing footwear, and is it something that you need to look at replacing footwear. So sometimes what happens is we have shoes that we may have only had for 6 months, but they develop certain wear patterns. And when they develop these certain wear patterns, they throw our posture out of alignment. And just having regular checkups for footwear, for your orthotics, and also your overall posture is a really great way of looking at preventing problems. And what I find is that checkups anywhere from 3 months to 6 months, doing these checkups, then we can actually highlight any particular problems that present before they become fully fledged pain, before they're really affecting your actual posture and the way that you walk and doing your activities. So prevention's a really big key. So what we look at your Podiatrist Brisbane is we look at giving you the best results in the shortest possible time, and that's our aim. So we want to give you foot pain relief ASAP. So what I'd encourage you to do today is go through and have a read, look at implementing some of these strategies that can actually really help you in relieving your symptoms and relieving your pain. And then when you get an opportunity, whether you come and see us at your Podiatrist Brisbane or whether you go and see another foot health professional, I'd highly recommend that you go there. So at least you can get a diagnosis and have a look at a bit of a treatment plan that you can implement to actually help settle the foot pain and get your foot pain to settle itself down. By implementing these 7 steps, so correcting your posture, making sure you've got right footwear or using footwear that gives you the most relief, look at decreasing the pain, so using topical preparations, sometimes the ice packs and rest. Look at decreasing the swelling using compression and ice and rest and elevation. You may want to look at starting on some really easy supplements, so you might want a bit of zinc and vitamin C. Look at implementing that. Just take the recommended dose on the bottles. Some of you may want to have some magnesium, but just check with your doctor to see that it's okay and it won't interact with any of the medications or tablets you're taking. Have a look at your water intake. I'd really encourage, anywhere from 1.5 to 2.5 litres of water today, more so from 2 to 2.5 litres of water per day, if you can start increasing. If you have a lot of coffee and tea, or you have a lot of soft drinks and things like that, I'd encourage that you decrease that and really look at upping your water intake as well. Have a look at massage, but just be careful of massage. Just do some self-massage at home and give yourself a little tester. If things are going okay and you find you get relief, well then you may want to look at getting the services of a massage therapist, or sometimes some people may be drawn to using a reflexologist to help with some of their foot pain as well. And then having a look at your prevention strategies. Now, your prevention strategies are about getting regular checkups, checking footwear, make sure that you're replacing them regularly. If you've got customized foot supports, look at getting those replaced regularly. If you've got off-the-shelf foot supports, so like a generic off-the-shelf foot supports, they probably need to be replaced anywhere from every 6 months to every 12 months. because the materials in them don't last, and to get the best benefit about every 6 to 12 months that they should be replaced. And then when you can, look at going to see a professional to get correct diagnosis. That's really the essence of it, is if you get the correct diagnosis of what's happening, what's going on, then a treatment plan can be laid out and implemented, and then what we can do is we can get resolution of your symptoms, get the pain to settle down, look at getting your posture back into the best position possible, and then look at getting you back into your activities as soon as possible. And that's our aim here at Your Podiatrist Brisbane. Thank you.